Barbados has done a number of things right. It has made mistakes, yes, but has done a number of things right. One of the things it did right was from very early on, it established a COVID 19 preparedness plan. That plan was in place months before we had our first case, even before it was declared a pandemic. Barbados had a national preparedness plan because we could see it coming. Another thing that Barbados has done right is that it has assembled a core of very skilled public health officials to manage a lot of the COVID 19 response. And actually, Barbados established its COVID 19 response unit again much earlier on than many other places. It established a standalone facility for the treatment of COVID 19 so that we did not compromise the lone hospital in Barbados or public hospital in Barbados. It banned persons going into elderly care facilities again from very early on before we had our first case, which allowed us to escape what happened in many places of the introduction of the virus into a community that is particularly vulnerable. So a number of steps were taken by the government to ensure that we were in a position to respond to the challenges when they came. We very early on ordered ventilators, for example, to make sure that those were available. We very early on established quarantine and holding facilities. All of these are critical steps to make sure that Barbados was prepared when the inevitable happened. And we've been able, through our very intensive process of testing, to make sure that persons were very rapidly identified, that we did the contact tracing, and that we could allow the persons who were tested positive to be isolated and managed and cared for. I think those are some of the critical reasons why we've been as successful as we have been so far. Well, first of all, I would like to speak to the welcoming nature of Barbados. A lot of countries say that they're welcoming, but Barbados has actually demonstrated this during the pandemic in terms of allowing Barbados to be used as a point for repatriation of thousands, I'm talking about literally thousands of persons of coastliners that were stranded all over the world, that were going to various places that claimed to be welcoming, but were not so welcoming when the pandemic hit. Barbados always allowed its borders to be used in terms of persons who wanted to be repatriated, and it has gained a lot of credence, a lot of public social capital as a result of that. We have recently announced the Barbados Welcome Stamp, which will allow persons to come and live and work here for a period of a year. It is not just a response to the pandemic, it is obviously a response to the economic situation that we find ourselves in. We will continue to observe the same level of protocols that we have always observed in terms of our response to the pandemic. We will make sure that persons who come here to live or to work are protected and are in an environment where they can feel safe. And in order to do that, we have required that every single person entering Barbados will be required to present a negative PCR test. It's very important to note that this is a PCR test, which is the gold standard of all of the tests that are being used in respect of COVID-19. If you do not have the test, and that test has to be uploaded before you actually come to Barbados. If you arrive without the test, then you will be tested at the airport and you will be required to remain there until the results are known. Anyone coming currently from a high risk country, and high risk is defined by the protocols defined by the World Health Organization. So anyone coming from a high risk country will be required to be quarantined for at least 7 days and to be tested again at the end of those 7 days, just to be absolutely sure. Those persons who pass the test or present the test that is validated by our health authorities, those persons will be allowed, if they're coming from low or medium risk countries, will be allowed to proceed into Barbados, will be welcomed with open arms and will be able to conduct their business, enjoy their vacation, do whatever they need to do, but they will be monitored over time. The other thing that Barbados is introducing is a geofencing technology that will allow us to monitor persons who are in quarantine through a bracelet. And this bracelet will again allow us to ensure that persons are not breaching the quarantine and that persons are adhering to the protocols that have been set in place. So all of this basically to ensure that we offer an environment that is both welcoming but also safe. one of the things that has characterized Barbados' response is that we have been following the science, we've been following the advice of the World Health Organization in terms of our policies. The current policy in Barbados is that there's no requirement for wearing masks in public, but there are a number of circumstances and contexts when it is required. So if you're conducting business in a place of business, if you are basically going to a restaurant, if you're going to a bar, if you're attending a social activity, if you're going to church, all of those situations currently require persons to wear masks. The guidance and advice of the public health authorities is that where persons cannot observe physical distancing, that is to be more than currently 1 meter apart, then a mask is required. So that policy may be subject to change because, as I said, we are constantly following the evolution of the science and adjusting our protocols and policies accordingly. However, in respect of travel into Barbados, a mask is required on the airplane until you exit the airport. So throughout your stay in the airport, you're required to wear a mask. And when you're leaving, you're also required to wear a mask once you're on the